I'm just sending you the picture.
Hello, everyone. Welcome to our weekly Q&A, open office hours with the doctors. And we have wonderful people with us today that are going to really fill out this phenomenal panel. Hello, everyone. Welcome to what we know, weekly Q&A, open office hours with the doctors. And we have wonderful people with us today that are going to
That's
really
lovely, Michelle. That sounds so good.
fill out this phenomenal Hello, panel. Everyone. Sorry about that.
No worries. It's that energy.
Yeah.
It happens. I have like 4 different screens in my office. And so anyway.
I thought your computer was responding to the energy.
I know we have all this duplication. We got so much phenomenal power on this call that it cannot be contained on one
You do. You are so awesome. You are so awesome.
But we are here with all these phenomenal doctors. And first and foremost, I need to do a disclaimer to make sure that everyone realizes that we are not here to diagnose, treat any kind of form of disease. We're not here to cure. All of what we're doing here today is sharing you information, education, and we encourage you to definitely talk with your medical provider about any changes that you seek to have in your personal healthcare regimen. So without further ado, I'm going to go ahead and start some questions. We had some questions turned in for us over the week that has just passed. And the first question that we had is actually from a 86-year-old woman. She has a herniated disc and she went to her doctor, and her doctor has shared with her that she should have surgery because that's the only way to take care of this herniated disc. However, she has talked with all of her older friends who said, do not allow them to cut in you because that's the beginning of the end. Yeah. So she wanted to have some insight into what are some of her options and what are some things that she can do. Anybody wants to take that one? Go ahead, Dr. Priya.
Thank you. I appreciate the opportunity. I want to address that as somebody who has treated family members and patients with chronic long-standing back pain. So the traditional methods, obviously, they're non-steroidals in high doses for, riding the bump, and then sometimes we do a Medrol dose pack, and sometimes we might do physical therapy once the acute episode is passed. But what I've found is that it's what I'd like to talk about is just exactly what I believe is the mechanism for most back pain. Now, this will probably address 80% of back pain, but 20% may be due to more serious causes that need to be thoroughly investigated and a diagnosis needs to be made. So the advice that I'm giving is not applicable to 100% of people with back pain, right? But with somebody who's in that age group, what I would suggest is using heat. If the acute window of the first 48 hours has passed, use a bit of heat to warm up that area to get some blood flow flowing through those muscles that are in a state of spasm and remembered injury more than actually an ongoing injury. And whatever the cause may be, whether it's a disc that's moved, that may be touching a nerve root or close to a nerve root, or the facet joints are little or the tendons that are attached to the spinous process, maybe they're weaker, the facet joints are more mobile or hypermobile, maybe the ligaments that are holding the facet joints in place are more lax than before. So what I would suggest is very slowly, cautiously, really slowing down to pace yourself, use heat to mobilize that area. Obviously, I'm talking directly to the lady at this point. And what I would say is in the shower, with all the safety precautions like a slip-free mat, or hold on to the bar and turn on the hot water shower onto the low back. And then do some simple this was taught to me by my yoga teacher. So it's not necessarily yoga per se, but it's just gentle movement. So you move the hip from side to side, right to left, and then you move it forward and backwards. And then you gently move it in circles that go to the front from one side to the other, and then to, the back from one side to the other, just about 3 or 4 in each direction. What that does is it gives the body a chance to re-equilibrate, and to for the facet joints and the tendons and the ligaments and all these structures that constitute the lower back spine, they are able to feel where they are in relation to each other, and put themselves back in order. So that's a simple way. And then for those of us who are sedentary a lot, I recommend a stretch which I call the Donald Duck stretch. So um, basically, you remember Donald Duck, right? So his rear end is, always on the up above, and there's like that tail that's wiggling up there, that little feather tail, right? So what I recommend is every once in a while, every 10-20 minutes, just to get out of the chair and then just bend over and lift the tail end up and push with your hips the tail end back. And then with your arms stretched forward, reach out in front. So as you're pushing your tail end behind, you're reaching out with the arms in the front. And what that does is it actually just straightens out and lengthens the spine. And everything that's tending to sort of fall out of place or whatever, it falls back into place. A very simple stretch. It's really very effective
So
to prevent.
you want her to shake her tail feather.
You heard that.
I love
That's
that.
what it looks like.
I love that. That is so cute.
Go ahead, Mama San, at 86, and shake your tail feather. Woo. Dr. Matt, you have something that you can also share with that?
Absolutely. Great counsel. Good advice there. When we hear discs, when we talk about disc herniations, we just automatically default to the oh my word, oh my gosh, there's something majorly wrong. And oftentimes what follows that disc herniation, it's followed by, and you need surgery. And so that's what we're facing. And so I think what you were talking about, Dr. Priya, is right on, but trying to demystify why that pain is there. Sure. And so there is, I think the heat is such an important aspect to this, because there is a constriction. The body is so smart. And so if it perceives instability anywhere, it could be in the low back, it could be in the neck, it could be in the shoulder, around a knee, it's going to stabilize that area by tightening the muscles up. Right. And so over the course of time, she's 86 years old, those muscles have been so chronically tightened around that disc, it's literally choked off the blood supply to that disc. And so that's the principle there. Where oxygen goes, tissues heal. And so that area has just been constricted of oxygen. So we're looking at ways to open that area up and get oxygen, get blood flow back into those areas. And so simple movement, shaking that tail feather will certainly help. I think depending on the size of herniation, in my opinion, anything below 6 millimeters of herniation can be very efficiently handled with conservative means. And that is with stretching, that is with soft tissue work. I am an advocate for soft tissue work. Having a trusted therapist getting in there and helping to lengthen those tissues. There is a phenomenon of what I call neurological engagement. And so if there's been an adaptation that's been in there, even for a few days, but usually it's months or weeks and months and perhaps years, the nervous system perceives that as new normal. So if those muscles have been tight for long enough, let's say her pelvis is off most disc issues that I see, there's a pelvic torsion. And most pelvic torsions are going to be connected through the kinetic chain. So that means a hip, knee, ankle, or foot will also on one of those sides, or it could be both, but typically it's one-sided, will have issue there. And so doing simple balance exercise, balancing on one foot at a time, and just the first time you do it is just an assessment to see which side is more unstable. And then for the next few days is you do simple balance exercise where you balance for 20 seconds on one foot, then go on the other side, then go back and forth. And a very interesting thing about balance is it's because it's neurological exercise, it's such a quick learning curve that in 3 or 4 days, you can expect to have a significant improvement in balance. And we're talking neurological, so that's the electrical system. And truly, where electricity goes, blood flows. So if we can maximize blood flow into her body and get that kinetic chain where it's talking now, and these muscles know how to coordinate, and then she's adding the shake your tail feather and some heat to this equation, now we're making some significant movements in the proper direction. So yeah, I'm not an advocate for surgery. There are instances where that is the intervention that needs to happen, but in my opinion, it's less than 10% fall into that category.
Also, one of the things that came to mind for me was, as you said, over time, the area has just kind of seized and locked into that position. And a lot of people, especially our elderly, our senior citizens, don't really drink much.
Exactly.
And so the discs themselves start to become dehydrated, and therefore all of that nice spongy cushion is gone, and you have even more pain accelerating. So I would also encourage her to really become aware of how much she's drinking, and to drink throughout the day, not in these big bursts, but to drink throughout the day. And also to look at nutrients such as glucosamine and chondroitin and collagen and vitamin C.
Yes.
Dr. Priya?
Could I add to that for just a second, Dr. Gamble? One of the things as we age is our proprioception is lost. And proprioception is what Dr. Ormond was talking about when he said, where your alignment, there are nerve fibers here and there that fall off, that drop off. And so that's when this instability comes into play, right? Which causes the disc to prolapse, or, the perception of a prolapse to cause the spasm of the paraspinal muscles and so on. So the cause of the loss of proprioception is actually an inability to absorb vitamin B12 as we age. So one of the great things that has helped, practically everybody I know that I've put on this is intramuscular shots of methylcobalamin, and not small doses. I'm talking mega doses, like 10 milligrams twice a week for life, intramuscularly. And
in that area?
No, just anywhere in the thigh, outer.
Okay.
So lateral aspect of the thigh, if you draw a triangle from the outer aspect of the hip to the inner aspect of the knee, any part of the lateral triangle you can use to inject the shot. And what that does is it revives some of the nerve fibers that are in the facet joints and that are along those paraspinal muscles. And, once they're revived, then there's no fear that that disc is going to come out all the way. And so the spasm can actually resolve on, much better, much faster on its own even. So vitamin B12 deficiency is a big cause of back pain, actually.
Wow. And I think she does have a vitamin B12 deficiency. Yeah. Anything you'd like to add, Dr. Clark? Because one of the things that happens, is that stress, as Dr. Matt was saying, stress, and you start to be locked into thinking of the pain being in that area, and it just kind of feeds off of itself, kind of thing.
Yes, absolutely. One thing that I will add is that, like you mentioned, stress and anxiety does have a lot to do with that. So, I would definitely, keep in mind that, what you're going through, don't allow the stress to creep up on you, because we have a tendency to do that, and that will happen. So just, be aware of your surroundings, and along with, the thoughts. A lot of times the pain, will cause us to think of in a negative direction. So, definitely make sure that you don't go in that direction, because we have over thousands of thoughts, negative thoughts per day. So, definitely just be aware of those thoughts that come to your mind when it's connected to your pain.
Yeah. All righty. Well, we have someone who has joined us. Melanie, do you have a question that you would like for us to address tonight?
No, I don't. I wanted to listen in, and I'm so thankful for all of you dedicating your time to provide and educate for us. So I'm just learning from the best. I'm just watching.
Well, if anything comes to your mind, just let us know. So I'm going to go on to some more questions that I have here that were sent in.
Dr. Gamble.
Yeah.
Real quick, just because I think this topic of low back pain is so pertinent. You know, they talk about 80% of the population at some point in their lifetime will have a significant bout of lower back pain, and there's a lot of hospitalizations that happen with this, and so it's a big issue. So I think the ground we've covered is really good. Another aspect that I always have my patients look at is their diaphragm. This is a muscle that I've been studying for 17 years, and I'm just getting warmed up with it. It's the most interesting muscle. So the diaphragm's connection to the core is pretty apparent. You know, if you're going to lift something heavy, we do it with breath. If you're going to play a sport, you know, these athletes know how to engage their diaphragm, and the diaphragm literally is the signal that synergizes all the core musculatures down in through the quads and through the adductors, but all the core is going to be engaged through the diaphragm. I find you mentioned anxiety, that's what triggered this. But chronic pain sufferers, they don't breathe well. Yeah. And really, you know, spoiler alert, none of us really breathe well.
In general.
So true. I was going to add to that when you said stress and anxiety about breathing.
Yeah, so important. And so, you know, by doing some of these movements, by getting that diaphragm breath. So I like to do a postural move where somebody lays on their back on the floor, on a, you know, preferably a carpeted floor, and they can roll just a small, like she's 86, so she won't have much mobility at all in her upper back and low back too. But I would start with upper back. Just take a small hand towel and roll it, and it would look a little bit like this, and she can place that on the floor, and she'll position it where it goes vertical between those shoulder blades. So it opens her upper back into extension. And that's a 10-minute exercise where she spends that time getting some extension out of the upper back, and she can breathe and spend that few minutes breathing. If she wanted to add one more component to it, she could slide a chair nearby and bring her knees up to 90 degrees. And so those lower legs are rested on a chair, and that opens up the pelvis space. So now you're separating the pelvis slightly from the low back, and so that disc, actually you're creating space there. And so that's a wonderful move that you can be in a position that allows for the spine to be relaxed and decompressed, and you can give yourself a window of time to breathe. And re-engaging that diaphragm has such a tremendous impact on not only pain, but anxiety. She'll sleep better, she'll heal quicker. There's so much that it goes into it. Alkalines the body because of the oxygenation. So that's an aspect that I just wanted to add.
That diaphragmatic breathing is key to strengthening our core abdominal muscles. And a lot of times when we have those back issues, it's related actually to a weak abdominal core. Completely. And what I tell people all the time is, instead of stressing yourself out with sit-ups and all that stupid and crunches and whatever, the best exercise you can do is some deep diaphragmatic breathing that, as you said, it'll open up all of those different vertebrae in the back, and at the same time strengthening the core. Absolutely phenomenal. So we're gonna be shaking our tail feathers. We're gonna be opening up our cores. Lordy, this old lady's gonna be doing all kinds of stuff.
Yes. There's a couple of more things just to tag on to what Dr. Matthews said, because he speaks so beautifully, and every time he says something, it brings this up. And I wanted to add completely, I completely agree with what he said about breathing. So just about the breathing, there are two types, right? One is when the stress level just keeps going up and up and up, and then you want to really bring that down, because obviously the greater the cortisol release, the more weak all of these systems that are constituting the axioskeleton become. So the way to do that would be, put two hands just directly in this area. So right, below the mid part of the rib cage. And then just push that part of the abdomen out as you breathe in. You can feel the hands come out. And then when you breathe out, you roll the abdomen from the bottom up. Kind of like rolling a tortilla or a wrap, rectus abdominal muscles from the bottom to the top as if you are rolling a tortilla. So, I mean, I'm not sure you can
A
see this.
wave kind of action.
Yes. So this inhale, and then when you're exhaling, you roll it up from the bottom to the top. You compress the muscle to push all the air out. And then during the stressful times, the stressful breathing, the breathing to reduce stress would be you take a deep breath into the count of 3 or 4, hold it for 3 or 4, and then breathe out as if you're breathing out through a straw. So do this 6 times, and any kind of stress will immediately exponentially plummet down. And then to tag on to the other thing that he suggested, where you could put the patient could put their knees up on the chair, there is another yogasana, which is, again, it may not be easy for somebody of her age to do, and if she has particularly stiffness in her spine, but lying flat on the floor with the hip and the knees bent like this in a sort of a triangular shape like this. And then stretch the arms out to either side like this with the palms facing up, right? And then you have your knees like this. So let's say they're like this, right? And what you do is you take a deep breath in, and then you roll the knees to one side and you roll the head to the other side. So what you're doing is giving a bit of torquing movement to the lower spine. So breathe in, and when you breathe out, drop the knees to one side and turn the head to the opposite side. So like this. Then breathe in and bring the knees back and the head back to the center. And then again, breathe out and do the twist. And you just drop the knees to whatever extent you can. It doesn't have to go all the way down if they can't do that. But what that does is it moves, and a little bit of adjusting can put everything back in its place, because all the adjacent fibers will be intact.
Yeah.
The one particular nerve fiber here and there might be lost, but the adjacent fibers that are intact will put everything back in place.
And to keep in mind, if you're doing that, especially because she's an older woman, to perhaps do it initially, especially with someone else there.
Absolutely. Absolutely.
And also to have maybe pillows and things of that nature on the side, so that she doesn't feel stressed to have to either twist it in one direction.
Yes. Yeah, we don't want any
to lift them back up.
Absolutely. We don't want any kind of accidents to happen or damage or injury from this.
Absolutely. And one other thing I would like to add to Dr. Gamble is that our emotions a lot of times are connected, when you're in pain like that. And, of course, with the hippocampus and the amygdala, which is affected, that's where the emotions stem from. So a lot of times our rhythm of our breathing, causes and creates electrical creativity and activity in our brain. So it's very important also that, the breathing exercise, that you be aware of that to help, that activity in your brain as well.
Beautiful.
And as you're breathing, to really, in alignment with what Dr. Clark is saying, to have affirming thoughts and visualization. What I share with people is, as they're breathing in that in-breath, to visualize the breath, the actual spirit of God flowing into you and flowing through and expanding your diaphragm, and have that huge glow, especially going to that area, so that you can visualize the healing energy being concentrated, and with that breath have that expansion occurring. And as we breathe out, one of the things to emphasize, in alignment with what Dr. Priya was saying, is that the exhalation breath is very, very important, because a lot of people, they just kind of do a little short breath out. And what Dr. Priya was sharing is that you want to really extend that out breath and breathe out completely, not hold anything back, but breathe out completely, because the longer that out breath, the more you're going to actually be able to activate the parasympathetic part of the nervous system, which helps you with what we refer to as rest. and helps you to down regulate the cortisol and all of those things. So
Absolutely.
phenomenal. Oh, I love it.
And Dr. Gamble, one more thing to add to everything that you were saying and everybody here on this distinguished panel is saying, is that the period of rest, right? I would say to not, I mean, acutely when you're in pain, to take rest for a little bit of time, but you don't want that to be more than 24 or at the most 48 hours. You really want mobility to return as soon as as soon as possible. So heat is what assists in that return of mobility. So using hot water bags, hot water pads, whatever, I mean, heating pad, whatever, right? So just to get going sooner rather than later, because
a nuance with heat that I've found to be pretty effective is appropriating the ratio. So heat on for 10 minutes. It could be a little bit longer, but 10 minutes is kind of a window, and then leave it off for an hour, and back on for 10, off for an hour. And because heat feels good, and we can mistakenly put heat on too long,
too much,
and you can engorge the tissue. So that engorging just means the blood
too
supply gets in there and it's
yeah.
congested. And so in acupuncture, that is congestion, that's stagnation. And so really the 10 minutes on, off for an hour allows for, we encourage flow in, which brings oxygen nutrients, but then the hour between the heatings allows that to get out. And be the same principle with ice. At the first stage, if ice is being used, 10 minutes on, off for an hour. So we're just trying to drive inflammation. Inflammation is how the body heals. And if we can take drive the inflammation, we can really capitalize on the body's normal processes of healing.
So now we have our next question that came in, and it was regarding alternating constipation and diarrhea. She's like, I don't know what to do, because either I'm always pooping or I'm locked up. And this again is I have all senior citizen questions today. So the seniors rule in this one. So this is again another senior citizen. And this is a major issue for our seniors. Major.
Yes, it is.
So I'm going to put it out to the group. Anyone who wants to jump in first on that one. We're talking poop.
This is right up Dr. Clark's alley. I would say, speaking to, I see majority of it gastrointestinal issues will have a connection to emotion. The mesenteric system is what we call it. That was before the brain is the brain as we know it now. This is the primary center of neurological activity. And we talk about having a gut feeling about things, or we see something that's terrible and it makes you sick to your stomach. Even anxiety and worry, we know where that lives. Like, oh, that makes me sick to my stomach, or I feel it here, butterflies in my stomach. So a lot of gastrointestinal issues, especially chronic GI issues, it'll be tied to emotion. And I'll even go further and talk about it's PTSD worthy emotion. So that's a pattern of consistent, let's use, let's say large intestine. It's despair, disgust, grief is huge, because large intestine and lung will share the yin and yang. Meridians, confusion, defensive-ness, self-abuse falls into that. Worry. These are some of those emotions that will affect on a chronic nature digestive health. So I turn the table over to you, Dr. Clark, because it feels like that's right up your alley.
Well, that is true. I mean, the gut and the people don't realize sometimes if you look at the picture of the gut and the intestines actually and the brain is kind of similar. So it's definitely connected. And I find this, and this question is kind of remarkable because, I've worked with several older people and they have that problem, and similar because of their body as they get older. A lot of things seem to happen, of course, like you just mentioned, with the nervous system, which is also connected. And so their nerves have a tendency to have an effect on their intestinal system, So I definitely want to the person that asked that question, again, with the emotions that's connected. Always say, exercises help. What you drink a lot of water. Older people have a tendency to hydrate a lot. So to stay dehydrated, hydrated, drink water. And so your body won't be dehydrated. So I find that also very common in older individuals, that also causes your bowels to lock up as well, because when you don't drink enough water, that does happen. The nervous system, a lot of them are upset because they don't have the right surroundings and the right people in their lives anymore like they used to. So they find themselves, more nervous, worrying more. That takes an effect again on the nervous system. So it all ties in with your brain and your intestines as well. So I would just recommend, definitely drinking more water, and not worrying as much. Be aware of your emotions. And if you don't have anyone, as older individuals do, around them sometimes, depending on their environment, depending on if they have any loved ones with them to help them to release, whatever they're going through, to release those enzymes or whatever's going in their body at that time.
Another thing to consider is the fact that the gut is actually the seat of 70 to 80% of our immune system. So especially when you notice that there's an alternating pattern of constipation and diarrhea, a lot of time the root issue is about food sensitivities and other imbalances, leaky gut in the gut area. And so if that's not addressed, then that kind of alternating pattern happens. So a lot of times people don't realize that even diarrhea is actually a precursor to constipation, so they go hand in hand when you're talking about imbalances in the gut. So a lot of times it's looking at the quality of the microbiome, making sure that you're having adequate probiotics and the proper probiotics. There are different probiotics for people dealing with different issues. And to also look at the food consumption. So a lot of our seniors, especially in these interesting senior citizen homes and places of like that nature, I swear they're trying to kill off our seniors with what they're feeding them. So the food itself is likely to constipate you and then give you diarrhea, because it's either, white sugar, white flour, white potatoes.
Yes,
that
potatoes
kind
are
of
very
stuff.
constipating. Absolutely.
Yeah. And then the alternating thing is, lots of grease, and so that in and of itself creates that situation. And a lot of our seniors have issues with their gallbladder. So because they have issues with their gallbladder, not being able to produce sufficient bile in a consistent way, either they're getting constipated or all of a sudden they're getting a gush of sludgy bile and it's giving diarrhea. So a lot of these different things come to mind. Dr. Priya?
Oh, thank you so much. I think you've highlighted some of the most important points between the three of you, and Dr. Gamble, that was very well said too. I think definitely, as Dr. Clark said, stress is a big contributor. And as Dr. Matthews said, the gut is kind of our peripheral brain, and it processes a lot of the stress. And so definitely over a prolonged period of stress, when we have prolonged periods of stress, when we have unhealthy bacteria growing in the gut, we develop this leaky gut syndrome, where the connections between the cells that are lining the innermost layer, the mucosal layer, they separate out like this. So these bad bacteria and their endotoxin products can enter into the bloodstream. And what that does is it can result in autoimmune disease like Hashimoto's, thyroiditis, and things like that. So one of the biggest things to address in alternating constipation and diarrhea is the diet. It is absolutely the diet. So I think we want to do a food sensitivity testing. Dr. Gamble, I'm sure you offer that to your patients. There are many laboratories that do that. I think Dr. Gamble probably has one of the best testing arrangements, and she also has probably one of the best counseling services in this. And so I would recommend that that the patients get their microbiome tested with a company like Biome or some other company that looks at the microbiome, perhaps Metagenics or Genova Diagnostics. And then I would also recommend that the diet is addressed based on food sensitivities. That would be actually number one. And then once diet is addressed and the diet is changed so that there are no preservatives, artificial substances, additives, colorings, those kinds of things. And then in the elderly, pain medicines are a big contributor to constipation. So narcotics and things like, so I mean, narcotics and other pain medicines are great contributors to constipation. So in fact, one of the compensatory mechanisms of the gut is to have diarrhea when there's protracted constipation. So another thing that I have found is actually somebody that works with me used to have a bowel movement once every 2 weeks.
Yes,
So
I've seen that one too.
yes. So
Yeah.
what actually helped that individual was I put them on a redox molecule substance called ASEA. Again, this is not any kind of an advertisement for any product, but after she started consuming 4 ounces of that twice a day, there's a big detox that goes on inside of the gut. And then she's actually able to have daily bowel movements that are normal. One other thing I've noticed in the elderly is when starting them on all older people have to be on micronutrients because they're not absorbing it adequately well from the diet. So even if we put them on the right diet with lots of green, fresh leafy vegetables, salad type things to start with, that detox itself might take a few weeks before the healthy diet starts to agree with them. And I lost my train of thought.
And also food enzymes,
I'm sorry?
Yeah,
Yeah,
food
enzymes.
enzymes,
Yeah,
Enzymes,
that's what I meant.
especially
absolutely.
in our seniors, their food enzymes have practically diminished to nothing.
Absolutely.
And the, ordinary foods like salads and things of that nature that would help, younger people actually
Yes.
bind up our senior citizens, ironically,
Absolutely. Iron does that too.
And
If they're
iron
taking
too,
iron
yeah.
replacement, they can have constipation, they can have
Yeah.
gastritis, they can have diarrhea. So when putting them on micronutrients, I use a source like Intramax. And I've actually had older people in their 80s tell me when we give them such a potent fabulous supplement. It has 415 vitamins, minerals, nutrients, amino acids, and it's only available through prescription, I believe. But I tell them to start with just 1 drop. It also has live probiotics. So definitely, as you mentioned, Dr. Gamble, the probiotic has to be live. So something like Doctor's Biome or Intramax, which has live probiotics, these are highly recommended.
So it would, for those of you who don't realize it, that means that it would more than likely have to be in the refrigerated section of your health food store or whatever.
Absolutely. And when starting these, whether it's a probiotic or it's the Intramax type micronutrient supplement for older people, because one person developed severe diarrhea from this, another person actually fainted. She passed out.
Wow.
And the reason that happened was it's such a strange thing. The body stops menstruating when you have below a certain level of iron, right? So with the very first dose of Intramax that she took, she got the iron. And she's 67 years old. She hadn't menstruated since the age of 30 after major surgery. She fainted, and then when she woke up, she started having her period. So what had happened was, maybe since the age of 30 until she was 50, 55, she had cycling of the ovaries, but the endometrial layer was just getting thicker and thicker, but not being shed.
But was being cleansed from the
So
body.
as soon as she got the iron from the Intramax, the body is like, get rid of all this trash that's been around for 30 years, 20 years.
Awesome.
And, so that's the thing. So in the elderly, even when we're doing right things, the consequences may be something that that they may not appreciate. Right. So always, I told her now, I said, now that I know, I would say when you start the Intramax back, start with 1 drop in. If that agrees with you and everything goes well, then add 2. And then, just slowly, do it slower if you're older, that's okay. You're smoother.
Yeah.
So.
And it's the same thing even when we're using ionic minerals, to use, a couple drops at a time to slowly build up the body's ability to handle it. We live in a society where it's like, more the better kind of thing. And it's like, no. When you really understand and appreciate how the body works, you realize that less is more.
Absolutely.
So I love that distinction.
And that brings me to one more point, Dr. Gamble, I forgot to mention. When we are hydrating, right? One of the things is if we take a liter bottle and fill it with pure water, like, reverse osmosis purified water. So, and then to that, we can add a couple of grains of this pink Himalayan salt and just a few drops of a squeeze of a lemon.
Yes.
And that gives enough sodium and potassium to make it isotonic,
Electrolyte.
which means just like the water in the blood.
Mhm.
And so when we consume that isotonic water, then we're much better hydrated,
Exactly.
usually speaking. So thank you.
Love that distinction, because a
Yeah.
lot of people don't realize that simply drinking water does not mean that it's being absorbed into your body. So a lot of
Absolutely.
people will drink the water and all they do is pee it out. And
Yes.
that's why it's important to have those electrolytes and things
Right.
of that nature within the water itself to increase the likelihood of you actually absorbing the water from the digestive tract.
Yes,
Yes.
ma'am.
And one last thing that I would like to add to that as well, as I mentioned before, it's so important that we pay attention to our nervous system and our emotions, because the microbiota influences the body's level of potent neurotransmitters, of the serotonin. So, which regulates our emotions and our happiness. So that affects the neurological system, the nervous system. And so when you're nervous, it affects your bowel movement, how things are processed in your gut. So that's why I said it's very important to pay attention to the diet, because as elderly people, as they get older, their taste buds change and they can't consume the same thing. They can't eat things that have spices and certain ingredients in them. So we have to be very, very cautious of that.
Cautious.
Mhm.
Couldn't agree
So
more.
we have one more question, and like I said, this is the session for our senior citizens. So now I have a question about a young woman of 97.
Oh,
Her son called me and he shared with me that his mother had recently been diagnosed with colon cancer.
oh,
And the doctors have decided that she's too old to do anything about it. And basically they said to just send her to hospice.
oh
So
my goodness.
they had the hospice people come in, and interestingly enough, in addition to just making sure that she's comfortable and not in pain and things of that nature, what they did is that they actually started removing all of her medications. And so he was calling me because he said, all of a sudden, mama is feeling so much better.
Off the medication.
So his question was, he was like, I'm thinking I need to go back to the doctor and ask him some questions. And he was like, what kind of questions should I ask? Because mama is feeling better after she's been taken off of her medication.
Oh,
So
wow.
I'm just gonna put that out to you guys before I say anything on the issue. But I'll put
Wow.
out to some of the medical doctors in you guys, with Dr. Priya and Dr. Matthew. What should he be asking the medical doctor who's in charge of his mom's case?
This is Dr. Matthew. Do you have any wise words also for us?
I don't know about wise words, but that's a real challenge. Sorry, I'm losing some light. The thing I say to my patients all the time is, I didn't put you on those medications, and I'm not going to take you off them. And so there has to be a conversation with that doctor. But so I try to be real careful not to step on other physicians' toes. It's, they've got their clinical reasoning and clinical justifications, and perhaps most likely they arrived at that justification for a completely different pattern than how I got there. But with that in mind, I think there is an opportunity to really advocate for this young lady, and so asking the doctor, a simple question is this absolutely necessary? Given the age, given the condition, is this one absolutely necessary? And some of the doctor will simply say, no, I don't think so. And some will say, yeah, this one is. And that you can just allow the doctor the freedom to narrow it down into the most absolutely critical ones. And then from there, it's still, even though it's doctor's orders, and I mean, be really careful with this one, even though it's doctor's orders, it's got to pass the gut test or the sniff test. If it doesn't feel right, you are the captain of your ship.
Right.
If it doesn't feel right, you need to trust yourself.
Absolutely.
These doctors, we are here to give our best opinion, and we know, a lot of things. We've seen, 10,000 cases of certain things, so we see patterns where you might not be aware of patterns, but ultimately it's got to feel right, and we have to communicate and explain ourselves adequately enough where it puts your mind at ease. We're like, oh, this is the right course. I turn it over to you, Dr. Priya. What do you say about it?
And just one clarification,
please,
is that the doctors had taken her off all the medications. And this is when she's starting to feel all good and vibrant and get like another burst of maybe another 10 years coming to grandma at this point, but who knows?
Then I take back everything I said. I would just go back to the doctor. You cured me. Thank you. I'm cured.
Dr. Priya.
Thank you. Thank you, Dr. Matthew, and thank you, Dr. Gamble, Dr. Clark. It's been wonderful. So I just had a few thoughts, and I think, first of all, I'm going to take a guess at what was one of the medicines that was in that lot that might have resulted in this. So I'm sure she was on a bunch of things, but one of the medicines I'm going to guess is metformin.
Yeah.
And when metformin is, somebody's taking metformin for diabetes, then it actually blocks the absorption of vitamin B12 completely. And so vitamin B12 has to be supplemented parenterally, that is in the muscle, by a shot.
Yes, those shots.
Absolutely. And so most likely the colon cancer developed because of profound vitamin B12 deficiency, which is also doctor caused. Now, it's not taught to us in medical school, so most doctors don't know this, because any treatment that involves just replacing a regular old vitamin is not considered a sufficient treatment. Sometimes it's thought to be incomplete and whatnot. So however, I think the son's question really is do I take her off? Because hospice, to certify somebody as hospice eligible, that means you're saying they have less than 6 months left. And I think the implicit question in what the son is asking is, do I keep her on hospice for 10 years if she lives on hospice, or do I just bring her out of hospice but leave her off her medicines that were so clearly damaging her? And so I think what we need to understand as physicians is, exactly as Dr. Matthews said, the patients are the captains of their own ship. If they choose to remain off their medication, there is no legal power on earth that can force them to take medicines that they don't need or that are harming them. And in this situation, stopping the metformin probably allowed her to absorb enough B12 in the diet to cause a regression of the colon cancer. So, that's how profoundly, iatrogenic deaths are one of the most common causes of deaths. And a lot of times physicians are not aware that we are, maybe contributing in small ways. So the thing that I would suggest to the son is absolutely have a discussion with the doctor and bring her off hospice, because literally to put somebody on hospice, the doctor needs to certify that she has only 6 months of life left. And from what you're describing, it looks like she has another complete 10 years of innings. And you want her, she wants to live. There's no reason. I mean, she wants to live. That's the most important thing. There's no reason to condemn her to hospice and comfort care. But on the other hand, which medicines to resume and continue and which ones to keep her off, that's a discussion and a negotiation. It's not just metformin that does that. Even proton pump inhibitors like Protonix, like Prevacid, even Pepcid can do that. So somebody has reflux. And in fact, reflux is because of, a lot of times, because of B12 deficiency. In fact, even the previous patient with the alternating diarrhea and constipation needed B12 shots. So one of the common themes in all of these three patients is B12 shots. As humbly I would submit to you is that all of these three patients need to be on B12 shots. And as for the other medicines in this lady, I would definitely keep her off the metformin and the proton pump inhibitors, both of which block the intestinal absorption of B12 because they block the receptors in the stomach. And so that is one thing. And then any other medicines that may, have indirectly or directly contributed to her sense of ill health, whatever it might be. Maybe it's a sedative, maybe it's an antidepressant. Yes, she has a right to stay off of those things. So, and then I would ask for B12 shots. That would be my advice. take her off hospice, take B12 shots, stay off the metformin and the proton pump inhibitors, and any other medicines that are contributing to her, mental decline or ill health.
And you bring up a very important point that many people don't realize, which is that the second leading cause of death is actually iatrogenic death, meaning correctly prescribed medications and procedures. And many people don't even realize that. And it's not that doctors have it out for their patients. It's just that the body is so unique that you can never truly predict what it's going to do.
Yes.
Pretty much.
Absolutely.
So what I said to this gentleman, because I'm not really PC, because for many reasons, but I actually threw the question back to him. I said, what type of answer are you looking for? Meaning that this doctor already wrote mama off, right? And said, you know what? It's time to call in the hearse and everybody come and get their last blessings and kind of thing. So my question was, what are you looking for him to tell you? I said, in reality, what many of us don't recognize is that there's only one true healer in this world, and that is God Almighty. There's only one true person that can sit here and tell you how much life you still have on your clock, how many hairs there are in your head. And that is the only thing that matters. I talk about diagnoses and prognoses and all of those things as medical hexing, because in reality, it's like a curse. People say, oh my God, the doctor told me I have 3 months to live or blah, blah, blah. No. And so the fact that mama is there kicking up a storm, I'm like, glory, hallelujah. Yeah. Oh, yes. I said, that's all you got to do. Say, thank you, God, and move about your business. Yeah. I told him, because I'm not PC, don't bother going back. He already wrote you off, and mama's doing better. She's enjoying herself. I don't want him to hex her again and tell her something else. But that's just me, you guys. Don't listen to crazy Michelle. Please listen to Dr. Priya and Dr. Ormond, because they are a lot more sane than I am.
And Dr. Clark as well.
Would you like to share something?
Thank you, Dr. Priya.
Sure. Thank you.
So, oh my goodness gracious. You guys, phenomenal. Absolutely tremendous. All of the wonderful insights that have been brought to the table together. And like I said, tonight was seniors night. It's interesting that all of the questions that came in tonight were from seniors 76 and above, which is interesting, especially in these times when we're going through the period of quote unquote COVID, where our seniors are the ones that we are most concerned about. But the reality is that it's not about our seniors so much as it is people with pre-existing conditions, because you have several seniors out there. I love you. You guys are younger and more vital than I am, and you all are a testimony to good health and wellness. So I thank you for paving the way and giving us such tremendous role models. So all of these seniors that you have heard from tonight, 76, 86, and 97.
Wow, I appreciate you. Thank you so much.
They are still kicking. And I love that you all have sent in those questions to us to let us know that you are still concerned with your health and you do not agree with people in society writing you off. A lot of times we write off our seniors and we had Dr. Priya talking about shaking your tail feather, because you still got some tail to shake. Yes. Go ahead and shake that tail feather. It ain't over till it's over. Yeah. And only one person's gonna tell you when it's over. And it's nobody in a white coat, so don't worry about it.
I couldn't agree more, Dr. Gamble. Oh my gosh, you just nailed it. It was beautiful. Very well said. I completely agree. And I think she should come off hospice, Dr. Gamble, because she deserves to be taken care of. Yeah.
Yeah, it's
she doesn't need to take medicines, but she doesn't need to be in hospice. You know?
Just because you're a senior and the medical establishment has written you off doesn't mean that you have to accept that label for yourself.
Completely.
Correct.
Mhm.
Yes, I always say it's the mindset. It's so important. Positive thinking can heal in so many ways that people don't imagine. I often say, as a man thinketh, so is he. So if you believe, I've known people that have gone in and had diagnosis. You only have so much time to live, but because they were determined and they wanted to change their way of thinking, and they were just stand still, stand steadfast with their belief, and things turned around. And off, again, I can't tell a doctor what to do and what not to do. But a lot of the medication, of course, as we know, when you take one, you have to take 2 or 3 more because of the side effects.
So
So
true.
again, it's a mindset, and it's definitely a mindset. And so for all we know, she could have already been thinking that way, and not shared that with her son.
Mm. Yeah. Yeah. So thank you, all you wonderful people. Thank you,
We
Dr.
appreciate you.
Ormond,
Thank you, Dr.
Dr.
Gamble.
Priya,
Thank
Dr.
you, Dr.
Clark,
Clark. Thank you, Dr.
and
Ormond.
thank
Such
you
a
for
pleasure.
our silent guest, Miss Melody.
Thank you, Melanie.
Please, please, please share this information. If you're looking at the recording, please subscribe to our YouTube channel so that you will get a notification of when we're live. We're live every Wednesday at 8 p.m. Eastern Standard Time. I encourage you to share this with your friends, with your family members, and to register. There's also the registration link in the description if you want to register to be part of the discussion so you can share your questions. We look forward to that. Or you can join us live through the YouTube channel and you can put in your questions there. Or you can email me some questions at sankofahe@gmail.com. Or you can call. Like I said, I had people calling in for some questions. And our number is 850-725-8322. So bring the questions on. Bring on your family members. And we love you. We bless you. And until next week. Mwah. Bye.
Thank you all.
Thank you so
Bye-bye.
much. We
Take
appreciate
care,
you.
everyone.
Take care.
Well.
Bye.
Bye.
Blessings.